My name is Faye Barrett, and I am the Senior Director of Support Services. I have with me today Marlene. Marlene, can you introduce yourself?
Hello, everyone. My name is Marlene Taylor. I'm a primary care medical provider over the last 3 decades, and I also specialize in HIV. Welcome.
So, in this series, we're going to overview HIV/AIDS among Black and Brown women. We're going to speak about prevention strategies. We're going to talk about the stigma to reduce HIV and also connect how we can connect Black and Brown women to affordable and accessible healthcare. For the learning objectives for today, we're going to understand the data and also identify key factors contributing to high HIV risk factors. Marlene, I want to ask you, who is most affected by HIV in the US?
So, as we can see from this slide, although Blacks comprise 13% of the population, when you look at the slide showing the new HIV diagnosis among women, 50% of the new infections actually are coming from women, African American, Black and Brown women. So our rates are higher when you look at the overall population in the US.
After seeing this data, are there specific social, economic, and healthcare barriers that contribute to the higher HIV rates among Black and Brown women? If so, how can we address them?
So that's a great question, Faye. Although we've made tremendous strides over the last 3.5, 4 decades, we still have a long way to go regarding disparities and the differences among the different ethnicities. But one psychosocial factor that has been identified has to do with stigma, education, access to care, and just getting free, accessible health care. It's very important that HIV, now that it's no longer a death sentence, that providers incorporate it into their day-to-day primary care.
So, Marlene, we know that there are several prevention methods out there, and we know PrEP is one of them. Why is PrEP important for Black and Brown women?
Black and brown women dominate all the new cases of HIV. There was a huge study and looked at the new cases in 2022. We're now accumulating all the data into 2023. But be it national or even locally in New York City, the disparity still exists when we look at Black and brown women. Ending the HIV epidemic is an initiative that has come about to end the HIV epidemic. And having access to PrEP is one of those initiatives. It's a very multifaceted approach. It's innovative and it really takes a lot of intentional work to really address this.
Yeah. So, what are the barriers preventing Black and Brown women from accessing or using PrEP?
So there's so many factors that go into disparities. And why is it that Black and brown women are the ones who all of the new HIV cases have arisen? But more importantly, what about access to PrEP? Things like education and misinformation about what PrEP is. Access to care. Some people are under the impression that they have to have a certain type of insurance or that certain clinics and practices don't offer PrEP. There's so much misinformation there, but also the stigma associated with HIV and AIDS. They even, in some cases, patients who are HIV negative come in, and when I mention PrEP, they look at it as though, oh, I'm not at risk. I'm not to be included in that HIV conversation. So there's a lot that goes into why.
You know, Marlene, I hear about a lot of these stigmas as well, especially for women who believe that PrEP was not designed for them, or they should not be using PrEP, that it's only supposed to be gay men supposed to be using PrEP, when that's not true. Women can use PrEP and PrEP, and there should be accessible resources for women to use PrEP and PrEP. So, speaking about that, how can healthcare providers better support these women in utilizing these prevention tools?
So again, an excellent question because a lot of times these don't get asked and people just go on and the numbers continue to rise in Black and brown women. So the panel of experts who looked at how can we address this has now made it important to incorporate having that discussion for regular primary care. Someone comes in for their annual physical, bringing up PrEP, offering HIV testing the same way they offer checking your cholesterol and checking your thyroid function tests, checking your liver and kidney tests and anemias, etc. So making it part of a formal primary care visit is one of those things that will hopefully normalize having that discussion. Then once that discussion takes place, incorporating it into the labs and then hopefully offering PrEP for those who are eligible.
Agreed, totally agreed. So to recap, Black and brown women face high HIV rates due to systemic barriers and social factors. Key factors include healthcare access and economic disparities and stigma. Regular testing and early prevention are essential in reducing HIV transmission. Challenging misinformation helps break stigma and promote awareness. So, as Black and brown women, we need to take these key points to reduce HIV stigma and HIV infection in our communities.
Thank you, Faye. Empowering healthcare providers to incorporate and normalize the conversation around PrEP will hopefully address the disparities that exist around HIV and new cases. Thank you for listening.
Thank you all.